Hey, good afternoon, you guys. My name is Shay. I'm one of the co-founders and the CEO of youturn. Youturn is the world's largest platform of evidence-based, therapist-led video content for substance misuse. Enterprises subscribe to youturn to reduce risk for drug and alcohol-related events, as well as supplement their mental health, wellness, or EAP programs. So pre-COVID, we had about 46% of the workforce that was struggling with substance misuse in some way, typically inside of the family. Post-COVID, 49% of workers said they are personally struggling with substance in some manner. This is a massive number. If you have an employee that has a substance use disorder, they're gonna cost you roughly $6,600 in excess cost over and above an employee that does not struggle with substances. So we have big dollars here. 49% struggling, maybe 2 to 3% EAP usage. We have a huge gap, and that's where youturn's focused. My two co-founders and myself, we're all in recovery from addiction. We all got sober through traditional methods. We all went to treatment. We did the whole 9 yards that way. Rich Jones, one of our co-founders, is most recently CEO of Favor Greenville. It's a nationally recognized addiction nonprofit. It was named Program of the Year by the Department of Justice in 2018. Through the nonprofit, which both Elizabeth and I were part of, we supported over 40,000 individuals with entirely free services over 8 years. 8,000 families went through the program, and Favor continues to add about 1,000 people going through the program every year. The youturn platform, it's made about educational content. The content educates, moves people across their journey. It then connects them, if needed, with our peer or family recovery coaches who can then guide them to additional resources, many of which are available on our marketplace, which also offers an additional revenue opportunity for youturn. Our content is very different, okay? So we built a set inside of a platinum recording artist studio, okay? We designed everything just like a Netflix show. So these things are designed in terms of stories with roughly 10 episodes per story, and the story lasts about an hour. So this is all micro content, maybe 5 to 6 minutes per episode. We're using, lights, camera, producer, the whole 9 yards to make this stuff look really good and engaging. In terms of the content, we've designed it where there's educational content. Now this can be used inside of the workplace or the enterprise for like annualized training, very similar to sexual harassment training. We also have evidence-based experiential learning through stories where they can learn through other people's experience. All of the people on the platform, they're real people. We don't have actors, we don't have avatars. So it's people with their real experiences. And we're still tiny, we're not real big yet, but we're beginning to grow. We're making good traction pre-COVID. We took a step back. We're starting to ramp up again. And that's been led through partnerships with various insurance brokers. So folks like Gallagher, Marsh is beginning to sell the service, and we're excited about building out a national distribution network through those folks. Through our direct sales and our partner sales, that's led to some really great customers. The state of South Carolina, where we service the VA, a nationally recognized treatment center called the Meadows, public health Fortune 500, a regional bank, a healthcare system. So we're covering everything and anybody in between. Every demographic, every type of substance, we have a lot of experience around that. My ask, my hope is that we can connect with payers, we can connect with health systems, or certainly any organization that wants to take their mental health services one step further and beginning to dive down into substance misuse. Thank you so much for your time. I appreciate it very much.
Thanks, Jay. Nice presentation. You can go ahead and unshare your screen while we do some Q&A here. Quick question came in from Esther Dyson. Where are you based? She says, are you based in Greenville, South Carolina by chance?
We are. We're in Greenville, South Carolina.
Awesome. Sounds like she might be familiar with you. Some other questions rolling in. Can you tell us about where you are on the competitive landscape? How are you different from other addiction startups?
Yeah, sure. I think the primary difference is most of the addiction startups that are out there are focused on what we call a willing participant. So somebody that has made a decision to either get sober or stay sober. youturn is actually focused on part of the 90% of the individuals that never go get help. So we're accessing people that are not yet willing to try to get sober. We do that in a very innovative way by educating the family members. We know that if we can educate the family members, that facilitates better communication inside of the family. That in and of itself reduces stress on the individual that's struggling with the substances. And I can tell you from somebody that's dealt with a lot of stress during my relapses, if I don't have my family on my back, if I can communicate with my family, I have a much better chance of staying sober. So we're all about educating through family members, leading to substance misuse, cure, if you will, that way.
Thanks, Jay. A couple questions just came in that are related. Do you have any outcome measures, or any other question was any validation data around improving recovery?
The majority of our outcome data has been tied to work we did through the nonprofit side. We've done a 2-year study inside of Prisma Healthcare's emergency department where we embedded peer recovery coaches. And anytime an individual got sent to the ER for an overdose, our peer recovery coaches were there. This was in conjunction with the Greenville Hospital System. We reduced reentry to the ER by over 80% over a 2-year period. So it's been very substantial learning. That's utilizing our ACE coaching model, which is assertive community engagement. YouTurn allows the coaches or the therapists to be much more efficient by providing the content out to either the family or the struggling individual to facilitate better communication.
I love that family approach.
It's different.
So there are a lot of mental health apps on the market. So where do you see your organization and your platform fitting in with other mental health services?
Yeah, we're complementary. We're supplementary. I mean, if you think about the mental health journey, particularly over the last year or so, so many companies have invested inside of mental health, right? So whether it's the C leadership or HR, there's been this investment inside of Ginger, Lyra, Spring Health, whatever it is. They're exceptional at connecting people that are willing participants that want to get to therapy. YouTurn really can serve as a supplement of that, where we're essentially specialists inside of the substance misuse space. What I will tell you is everything you hear inside of a room of AA or Narcotics Anonymous, stress and anxiety. So whether the stress or anxiety becomes, hits before addiction or after, it's tied together. You cannot address substance misuse if you're not addressing the stress and anxiety. And we know that a large subset of people suffering with stress and anxiety are dealing with substance misuse. So they're very tied together, but we're certainly complementary and want to fit with those applications.
Mm-hmm. And would the same be said for large mental health providers? You're trying to just kind of align with them and work in a complementary manner?
Yeah, absolutely. I mean, look, our core expertise, it's all we've done is substance misuse. So we just want to keep a very focused, or just stay very focused inside of that particular application. We can deal with stress and anxiety. We want to let somebody else do the clinical application. We want somebody else to provide, the therapy. That's not what we do. We help families move across their journey, get educated, and then we connect through our marketplace with these other resources. And it could be the company's mental health application. It could be the EAP. We don't really care. We just want to get people moving on their journey and connected.
One more quick question, another one from Esther Dyson. Who's on your board?
My board is myself, Rich Jones, and Tanya Clark. She's the former CEO of Heritage Health Solutions in Dallas, Texas.